So the second big thing that we were going to talk about that I got recommendations on were foot care. And what a day to talk about foot care, because we did 250 double unders today. So we're going to talk about that. Also, we're going to talk about the calf and things going down here in the back of the leg that can cause some foot pain as well. So here's what I want you to think about the back of the leg. You could go hamstring, calf. Think about a ribbon that goes from here into your calf, into your Achilles, wraps to the bottom of your foot, all the way to your big toe. So you could have tightness in your calf, pulling, causing pain in the bottom of your foot. All right. So we're going to stretch out these things down through here, roll them out, focus on that. There's many things that can cause this pain. We're just going over a little bit, so this video isn't 15 minutes long. All right, cool. So first off, we've talked about this before. We're going to talk about calf stretches. My calves, I can tell, are blown up right through here from all the jumping. So again, calf stretch 2 ways. Right through here, hold for about a minute, okay? This is going to get this top portion of this calf. And then we're going to bend the knee, come in. You're going to feel that a little bit in the bottom of the foot, but mainly back in the Achilles area. Again, hold for about a minute or so on both. If you can go farther, but don't force it. All right? Now, with the balls that we handed out, I got a foam roller here too. We're going to get down on the ground first, and I want you to roll out those calves. All right? So we're going to go right through here. Now, remember what I talked about last time? When you find the muscle in the sore spot, I want you to use the muscle. So there's a little bit on the outside of my leg there. So I'm going to put a little pressure into that foam roller. Then I'm going to move my foot back and forth. And that's gliding that muscle right underneath that foam roller. If you don't have the foam roller, do the same thing with the lacrosse ball I got you. So here, press down. Woo! Go back and forth. Get in through there. Work that area out, okay? And the next thing, bottom of the foot, same thing. Just take this ball after you do your double unders, after you do your box jumps. We did a lot of box jumps at North yesterday and at West. But roll out. So when you find that sore spot right about there, man, that's sore, I'm going to bend my toes back and forth. All right? And all those tendons that make your toes flex, that's gliding over the ball. And that's just breaking up that thin layer of tissue. Plantar fascia. You probably heard that. That's just uncrinkling all that. Think of that fascia as like saran wrap that just gets kinked on itself. We're just breaking all that up, all right? And that's going to get those toes and feet working like they should. Last thing, people with plantar fasciitis, all right? I hate to even say the word. We have to activate that muscle, all right? So let's zoom in down through here. What we're going to do is we're going to make this muscle contract to draw in the foot. I don't want you to think curl your toes. I want you to think make this arch bigger. So if there was a string attached to the top of your foot here, like my sock, I'm going to pull it in. See how my arch got higher? That's my foot contracting. I'm just going to hold that and relax. Okay? I'm going to do it again. Think about like this right here. I'm going to draw it in, hold, and relax. And that's going to activate that fascia in the bottom of the foot. So we got stretches. We got rolling out. Remember, move the muscle. Don't just roll the ball or the foam roller over the muscle. Get the sore spot, roll it there. You know what else you can do? There's a lot of bones in the foot, so you can adjust that foot, which you probably didn't know. So get that here. Get this nice Under Armour sock here. We're going to grab this like this right here and relax that leg. Da-da. There we go, and there we go. All right. If you need anything else, I'll be in the clinic.